Madam Chairperson, distinguished representatives of national institutions and international agencies, ladies and gentlemen. Allow me first to extend our sincere appreciation for inviting the International Committee of the Red Cross, the ICRC, to this forum organized by UNGC. In line with the international mandate and mission of the International Committee of the Red Cross, I would like to address the topic of this presentation by introducing a humanitarian dimension into the discussion over the needs and challenges ahead for the global healthcare sector in the post-pandemic era. Finally, I will provide some recommendation as this was requested to the ICRC by the organizers. For over 150 years, the International Committee of the Red Cross has attempted to save lives and preserve the dignity of people affected by armed conflicts and violence. We have witnessed the human cost of World War I and II, of all conflicts of the 21st century and of more contemporary ones, such as Syria, Ukraine, South Sudan, Ethiopia, just to name a few. The ICRC has been supporting national health systems weakened by multiple waves of violence, protracted armed conflicts, underdevelopment, and lack of investments. A case in point is Afghanistan, where our organization has never left the country since 1987. In contexts such as Yemen, Somalia, or Democratic Republic of Congo, millions are now displaced and have been affected by the disruption in routine immunization and suffer from lack of clean water and sanitation. Millions of children are in critical settings at risk of dying by vaccine-preventable diseases and malnutrition. The COVID-19 pandemic has been a powerful revealing moment as it has surfaced structural weaknesses within the global community. At the same time, it has pointed out important lessons for us to be better prepared when the next public health emergency of international concern will come. Almost 25% of the world population live today in situations of fragility, conflict, and violence. Persistent inequities slow down the achievement of human development. Close to 1 billion people in the world live in slum conditions. Every day, 16,000 children die before their 5th birthday. They die of pneumonia, malaria, diarrhea, and other diseases. This is 14 times more likely to happen in sub-Saharan Africa than in the rest of the world. 99% of annual maternal deaths in the world occur in developing countries. Women in Chad have a much higher risk of maternal death than women in Sweden. A child born in Sierra Leone can expect to live for 50 years, while a child born in Japan can expect to live 84 years. Universal health coverage is not accessible for the 30% of the world population. And we know that poverty, underdevelopment, and fragility across the world are driven in 80% of the cases by armed conflicts and other situations of violence. I would like to touch now on the needs of the healthcare sector in the post-pandemic era. In addition to the gaps described earlier, we need to consider the reversals during COVID-19 pandemic. Some of them were the disruption of essential health services delivery, an increase in 2021 of 4.5% in the morbidity of tuberculosis. This was the first time in many years TB services were disrupted by the COVID-19 pandemic and by the ongoing conflicts in Eastern Europe, in Africa and Middle East that have further exacerbated the situation of vulnerable population. In 2021, 40 million children missed a measles vaccine dose, and there have been over 9 million deaths from measles worldwide. Dr. Tedros' comment was, "The paradox of the pandemic is that while vaccines against COVID-19 were developed in record time and deployed in the large vaccination campaign in history, Routine immunization programs were badly disrupted and millions of kids missed out on life-saving vaccinations against deadly diseases like measles. These are the lowest global coverage rates of measles vaccination since 2008. The ICRC knows very well that communities affected by armed conflicts are impacted by direct and indirect health consequences. A powerful example of public health issue caused by the breakdown of health systems is the management of non-communicable diseases. These diseases cause 74% of all deaths globally, and of all NCD's deaths, 77% occur in low and middle income countries. There is a large debate around the preparedness that should be put in place for the next pandemic. The new pandemic treaty is underway. At the same time, COVID-19 has shown aspects that we were perfectly aware of. For example, that pandemics slow down the achievement of Sustainable Development Goals for a million people, that strengthening health system through a primary health care approach is critically important to achieve universal health coverage. The foundations of global health security lie upon resilient and strong health systems and communities able to prevent, mitigate, and respond to shock and public health emergencies. 6 building blocks in health system strengthening are all extremely relevant. All this was well known by the International Committee. Organizations such as the ICRC and others have stepped into this global emergency by incorporating the COVID-19 response into existing public health programs. Joint initiatives like COVAX and the Humanitarian Buffer unfortunately could not cover the last mile, especially for population living in fragile and conflict settings. In our view, the main challenges for the health sectors are 3. The perfect storm, the high number of conflict across the world, and attacks to healthcare. The perfect storm is the combination of multiple threats such as climate shocks, armed conflicts, economic and food insecurity, pandemics, that many populations in many regions of the world, specifically in the Sahel, in the Horn of Africa, and in Afghanistan, are stranded by. All these factors are forcing an increasing number of people, particularly children, into malnutrition. As we speak, more than 30 million children in 15 worst affected countries are suffering from wasting and acute malnutrition. The second challenge is the high number of armed conflicts across the world. According to the ICRC, there are more than 100 ongoing conflicts in the world currently. The coexistence of protracted and forgotten humanitarian crises, together with the little prospect of commitments by states to face and work on conflict prevention, management, and resolution, makes the global picture I have described at the beginning of my presentation even bleaker. The human cost of the war in Ukraine has been and is dramatic. The wider political, economic, and social consequences are a matter of concerns in many parts of the world, as the conflict is disrupting livelihoods, affecting energy and commodity markets, placing further stress on areas that were already fragile, such as Yemen and the Sahel. The third challenge is the attacks on healthcare. In 2016, the UN Security Council adopted its first resolution on the protection of healthcare in conflict. Resolution 2286 was supported by 80 states and included steps that could mitigate such attacks. 7 years on, access to healthcare continues to be impeded due to a disregard for international humanitarian law and obstruction or criminalization over the provision of healthcare in some cases. I would like to conclude my presentation with some recommendations that, for convenience, can be included into 3 main categories. The first is the focus on community resilience and stronger systems. The second is strengthening international multi-stakeholder cooperation. And the third is including a humanitarian dimension into global, regional, and local initiatives to assist people in need and promote sustainable development. The first recommendation, the focus on community resilience and stronger systems, entails giving voice and visibility to those excluded and marginalized, making invisible the visible, and including those most isolated by covering the last mile. The involvement of local communities in designing and planning of relief of development interventions will build ownership and resilience and help preparedness and response. Working on the 6 health system blocks, but also on education, water and sanitation, social and business systems, will lead to better global outcomes. Strengthening health systems in fragile states through a primary health care approach is key to achieve universal health coverage and ensure equity. International support to Africa CDC is critically important, not only for the African continent, but globally. As for the second recommendation, strengthening international multi-stakeholder cooperation, we would suggest a stronger international cooperation, if is possible, if solidarity among all stakeholders at local, regional, and global level can be re-established through dialogue. There is no doubt that science, technology, and innovation are good propellers for global health security. In our view, innovation embodies new ways of thinking, analyzing, and finding solutions for all, particularly for those with minimal access to health care. Digital medical systems and technology support the development of new diagnostic, therapeutics, and vaccines, and in this respect, the partnership between public and private sector is critically important. Technology also supports capacity building, clinical decision-making, and data analysis. In recent years, the venue of global health diplomacy has shifted to include larger spaces of negotiations and influence and a larger number of actors that include the public and the private sectors, but also humanitarian and development agencies. Global health diplomacy is about engaging in multi-level and multi-stakeholders negotiations that are needed to build consensus, strengthen international cooperation, and shape global health policies and interventions across the world. In this respect, China plays an increasing and influential role in foreign medical aid and in the reconstruction of conflict and disaster areas across the world. A good use of global health diplomacy with influential global actors increases the chances to achieve goals such as universal health coverage and keep the promise of leaving no one behind. The third recommendation is including a humanitarian dimension into global, regional, and local initiatives to assist people in need and promote human sustainable development. ICRC has a strong opinion about the cooperation between humanitarian and development actors, particularly in unstable context. In these settings, we need to think short-term and at the same time, due to the protracted duration of the crisis, a systemic and developmental approach is required. This concerns the implementation of the 2030 Sustainable Development Goals Agenda and initiatives such as the Belt and Road Initiative and the GDI promoted by China. For this reason, the ICRC has been increasingly present in high-level meetings at the UN Security Council and active within the international negotiating body for global and for other global health initiatives. Whether in Ukraine, Myanmar, Afghanistan, Iraq, Mali, or Colombia or elsewhere, the ICRC will fully assume its humanitarian endeavor. Every single day, thousands of ICRC staff and their Red Cross and Red Crescent partners travel to delicate areas to assist people in need and face directly with the brutality of war and armed conflicts. Our organization is thirsty for peace and improved coexistence of people and countries. Thank you for your attention.